Hi again. I'm Dr. Vilar, Professor of Pharmacology at the University of Antioquia in Colombia. And on this presentation, I will describe some examples of parasite resistance that are nowadays the norm rather than the exception in sheep and cattle farms. On the previous two presentations, we did a quick overview of the main parasites of concern in ruminants in tropical countries like Colombia, and I tried to explain in simple terms how and why resistance makes its appearance on any farm when an antiparasitic drug has been used for an extended period of time. And on this video I will illustrate some field cases dealing with the common cattle tick. You can see a nice photograph of what a tick looks like on this slide, even though it's not a cattle tick. And the second case will be the most common parasite of concern in Colombian sheep and probably the rest of the world for that matter, which is the barber pole worm. On this slide we have a short video clip of a cattle ranch that had repeated problems of massive infestations by the cattle tick Rhipicephalus microplus since it was first established 10 years ago. Every husbandry and management practices on that ranch has been really in favor of the cattle tick from the very beginning. They brought in a very susceptible breed of cattle from Texas, which is the Brangus. They're nice looking animals, as you can see that female and her calf, but they have no innate immunity to repel this tick. Now the type of forages they selected were different species of signal grass that also favor the environmental stages of the tick, and in particular make it very easy for that tick larvae to climb to the top of the grass leaves and just simply wait for a cow to walk by and attach to the animal's legs. Also, the rest period of those paddocks was only 30 to 40 days, which is not enough to break the cattle tick cycle. And finally, the climate is favorable in terms of temperature and humidity for the tick. The locations in Colombia that have an elevation of more than 2,000 meters above sea level, they're still too cold for the survival of this type of tick. However, this ranch was at an altitude of 800 meters, which is ideal temperature-wise for the tick. Now, we conducted a study to determine the efficacy of different acrosites against the cattle tick, but before going into the details of the study, I wanted to show how efficacy is typically calculated for an acrosite against the cattle tick. In order to evaluate the efficacy against ticks, there are three variables that would need to be included in any study, and really any one of them could account for the drug having a 1% efficacy. One would be the number of ticks in the animal. Another one would be the fecundity, which is the percent of the tick weight that is laid as a clutch of eggs. And finally, the fertility, which is the percent of those eggs that will eventually hatch. You could have compounds like fluaceron that have no immediate effect on the number of ticks and does not really affect the oviposition of those engorged females, but they make all the eggs infertile. In other words, none of them will hatch. So for this compound, really the disruption of fertility of those eggs could still break the cycle completely for the parasite and prevent a new generation of ticks from infesting animals again. And just affecting this one reproductive parameter could account for having a 1% efficacy. So in this illustration we see a hypothetical curve in blue that could well be the average number of ticks on a group of animals, and as we can see, it fluctuates a lot by nature. If we measure the effect of any drug chemical on this parameter, we would definitely need to account for this normal variation, which can be enormous for ticks. Let's imagine that we apply a drug on the day that the counts of ticks is at the highest peak, and you measure the efficacy 2 days later when most of those ticks would have naturally on their own dropped from the animal. Obviously there would be a great mistake due to to that natural variation, and it would be wrong to attribute the decrease in the number of ticks to the effect of the drug. So this is why it's so important to compare your treated group with a control animal group that has not really received anything and is exposed to ticks in a similar manner as your treatment groups, ideally in the same paddocks. Now, by contrast, if we were to determine the efficacy of dewormers, let's say against any runworm, this huge fluctuation does not really exist. And if you go like 10 or 14 days after a treatment and you count those fecal egg counts, you will notice that they haven't really changed that much in the control group. So for ticks, it's a different ball game, if you like. It becomes really important to have a control group, and I'm going to show you a study on this next slide that illustrates the importance of this control group. Here they wanted to measure the persistent efficacy of two microcyclic lactones against the natural Rhipicephalus microplus infestations in cattle. This is in the Mexican tropics. They divided a large herd of cattle in three large groups. Two were given either moxidectin or ivermectin, and one served as the control of non-treated animals. Then they measure the number of ticks on different days for a period of more than 3 months. And as you can see, the data is presented as the average plus or minus the standard deviation of the number of those ticks on each group of animals. And first, I wanted to draw attention to the importance of comparing everything against the control group. If you notice, there is great variation in the number of ticks between different days for this particular group, which is that fluctuation that I was alluding before. Let's, for example, compare day 14 to days 35 and 63. We see that the numbers almost double, and then they drop from 300 ticks per animal on day 63 down to 100 on day 70. So basically, when you calculate the efficacy just using this one parameter of tick counts, which, as I mentioned, is incomplete because they didn't really determine the impact on reproductive variables for those ticks, they would definitely need to compare the effect of the treatments against the normal average of ticks that would be expected to find if they hadn't been given anything. Now, if we look at the final column, we can see that both microcyclic lactones had a very prolonged persistent efficacy of up to 100%, which lasted for almost 2 months with these long-term formulations. And this is really what would be expected to occur, and you will find it on the label claims that this is that it will keep your animals clean of ticks for 2 or more months. Now on the next slide I will show you something similar that we did applying these same long-term formulations of ivermectin in the Brangus cattle ranch, but the main drawback we had is that we couldn't really include a control group. However, based on this study, we knew that if there was no resistance, ivermectin should keep those animals clean for at least 2 months. I'm going to start by showing a picture of the scutcheon of a bullock on day 0 on the left image, and 10 days after he was given an injectable dose of the long-acting ivermectin. As you can see, there is a slight reduction in the number of ticks, but if there was no resistance, that animal should be completely clean 10 days after the treatment. In fact, we did manually count every one of those ticks that were engorged to quantitate the effect of the treatment. And not only that, but we also collected ticks after the treatment to see if they were viable and they would lay a healthy clutch of eggs. And on this other table, we have the results of that one study. As I said, we could not include a control group at the request of the owner of those animals. What we could do was just compare the number of ticks every so often to those on day 0 prior to the treatment with ivermectin. Now on the first line we have the average number of ticks per animal on day 0 and then 10 days after the treatment. And we did two trials on two different occasions, one in June and another one in October, at two different farms. The first one at Tarso is the one for this Brangus cattle ranch, and as you can see, there is a reduction in the tick numbers of 75 and 74% in both occasions. For another farm, which I will not say anything here, the reduction was even less, of only 43 and 40%. So knowing that ivermectin should have completely cleaned those animals by day 10, we can definitely assure that there is a high degree of resistance. And when we incubated those ticks, we noticed a reduction in the overall weight of the engorged ticks of about 40% of their normal size, which obviously explains why they didn't lay such a big clutch of eggs. And this is obviously a desired, welcome effect of ivermectin. However, all the eggs were fertile. There was no effect of on the fertility of these eggs. So in conclusion, we could say that as ticks become resistant, what we will see is that there is a gradual increase in the number of ticks that the animal should have after being treated, and there will be another effect on the size of those resistant ticks that, even if they are viable, will not allow them to reach their full engorged weight. Now, I don't want to bore you with tables, but bear with me on this one. I simply want to show the rest of this study, which is summarized here, and you can read more in detail in the reference below. As you can see, we look at the three variables that you want to contemplate if you want to assess the efficacy of any drugs. We did tick counts on the animals, the egg mass that is laid by the tick, and the percent of eggs that will hatch. We collected data every 10 days for 50 days after the animals were given the injectables, and as you can see, even if the counts were significantly lower compared to day 0, there was no single day that the animals were free of ticks, and obviously all those ticks that were not affected were resistant, and they will be the ones that will pass on their genes to the next generation that will obviously also be resistant. And if we continue using ivermectin, there will be eventually a point that all the susceptible ticks have disappeared, and at that time the drug will have completely lost its efficacy. If you remember, on the previous video I mentioned that the skin lesions created by ticks with exudation of fluids, blood scent, and so forth produce the ideal environment that attracts flies. In fact, there is a very close association between the load of ticks and the presence of myiasis caused by the screwworm, whose scientific name is Cochleomya omnivorax, which literally translates as man-eating fly larvae. On the study shown here in preventive veterinary medicine, they found that cattle highly infested with ticks had 4 times more risk of presenting myiasis than cattle with a low tick load. The photograph that you see here is from one of those Brangus calves with a very heavy infestation of ticks on the breast, and the short video clip that you can notice here shows that same area a few days later, and you can notice a clear opening on that skin by invasion of the screwworm, which was creating obviously great tissue damage inside that animal. This animal should have probably been put to sleep on humane grounds because he also had a chronic respiratory condition. Instead, they decided not to, and he was unfortunately found dead a few days later. Now, I said I'm not going to show you another crowded table, but I would like to mention that we can pretty much recreate in the laboratory what the farmer does on his cattle. There are a number of in vitro assays that we use to detect resistance, and that gives a pretty good idea of which commercial acrosides will work best on any farm. On the reference on this slide, you can read more about the details and results of those type of studies in our laboratory. And here I will simply explain what you can see on this slide. it shows how we do the adult immersion test. We take a large group of engorged female ticks uh, that have not started to lay eggs, obviously, and expose them to any acrocytes in falcon tubes. We use the same concentrations recommended by labels of commercial products. And after 5 minutes, you place them in petri dishes and keep them in an incubator for 20 days. Then you weigh how many eggs they laid, and then you put them back in the incubator for another 20 days to count how many of those eggs will eventually hatch. This is kind of a long and time-consuming process because we do each tick individually. But in the end, it gives a pretty good estimate of which products will kill at least the adult ticks. And if it kills the adults, the chances are that it will also do the same for the larvae and the nymphs. Now, another parasite problem, this time in sheep and goat farms, is caused by the roundworm, commonly known as the barber pole worm. The history case on this slide involved a 500 flock of crossbred sheep. They were grazing in paddocks of guinea grass with 40-day rest periods, which, if we look at the external life cycle for this parasite, is definitely not enough to break that cycle. We estimated that larvae on that pasture can stay alive for at least 2 months, if not longer. The producer called us because of heavy mortalities of lambs, 13 just in the month of September. And a field inspection revealed really many problems that had to be corrected. To start with, there were about 75% of the ewes that had really poor body conditions of 2 and many with 1, which is kind of a telltale sign of poor nutrition and that the animals are not capable of harvesting their own groceries, if you like. There were also many small and weak neonates that needed to be raised artificially because the ewes were not producing milk. Again, another telltale sign of poor nutrition. And the cause of death in lambs and some periparturient ewes was diagnosed by doing fecal examinations and necropsies on some of those sick animals, like the ones you see on the right images. The top one is from a 6-month-old lamb. He was severely anemic by the extreme white pale color of his eyelid. In fact, a blood work revealed a packed cell volume of 4.5%. With a total protein value of extremely low of 2.5. If you notice the vacutainer tubes, there is a really tiny small clot, and that blood is definitely very watery. This animal died before we could even do a blood transfusion, and an inspection of the true stomach or abomasum revealed many of white threads, which were positively identified as the barber pole worm. Now, another characteristic they develop is the so-called bottle jaw, which is basically an accumulation of edema fluid in the submandibular space. The parasite causes an extreme blood loss, and so not only red cells drop, but other components of blood, including proteins, which, as you probably know, are important to maintain oncotic pressure and prevent fluids from leaking outside of the vessels. So basically, that bottle jaw could be explained by the low protein level in plasma, which, as you notice, was pretty low on this animal of 2.5. Normal is between 5 and 8 grams per deciliter. Now, the ewe on the lower image had lost both of her lambs recently. She was also severely emaciated, as you can see there. It would be even generous to give her a condition score of 1, I would say. She was also very anemic. You can notice the pale eyelids, a packed cell volume of only 8%, very hypoproteinemic, and she died shortly after we were taking these pictures. Now, at least we were relieved to see that 3 lambs that received blood transfusions made an excellent recovery of their anemia a couple of weeks later. And having made a diagnosis of parasitism by the barber pole worm, aggravated obviously by poor nutrition in this flock. The farmer wanted us to advise which dewormer would work against the parasites. So we did a fecal egg count on groups of more than 10 animals each, and we pretty much used every dewormer available commercially against roundworms. On this table we have the results of those fecal egg counts on day 0, and then 10 days later after the treatment with albendazole, levamisole combined with tricobendazole, ivermectin, moxidectin, and trichloroform. If we look at the final column that shows the difference in fecal egg counts between day 0 and day 10, the results were very similar to those reported in many other countries, including one in Argentina. Basically, all the wormers have lost their efficacy. There is 100% resistance. In this case, there were 2 that made a partial reduction in egg counts in all the animals, which were moxidectin with a 70% reduction, and trichloroform, whose trade name is nagibon, and that caused a 30% reduction. Also, if you notice, there is very little variation in fecal egg counts in the control group, unlike we saw for the cattle tick, that numbers can rise and drop very quickly from one day to the next. And there is one other point I would like to draw attention, and that's the huge difference that can be seen in egg counts among animals in a flock. If we see in each group there were animals with very low counts of only 50 or 100 eggs per gram, and some of them had all the way up to 40,000 eggs per gram. On this type of studies, really it's normal to have standard deviations that are much larger than the overall mean for the group. So based on these results, we proposed to reserve the use of moxidectin and trichloroform for the lambs, and we outline a management program to try to break the cycle of the parasite. At this point, it's really pointless, if not ludicrous, to think that we can solve the problem with drugs we have on the market. We will cover the basics of alternative approaches to the use of antiparasitic drugs in the so-called integrated management practices video. Before I end, I wanted to at least mention one other parasite for which we have no data on its resistance to antiparasitic drugs, but considering the high prevalence in the dairy cattle in this area and the great production losses it may be causing, it would definitely be important to know where we stand as far as resistance go. And I'm referring to the so-called liver fluke, Fasciole hepatica. The last survey we did in 2014 showed a prevalence of almost 30% in 1,000 dairy cows. And this short video clip was given to me by a local slaughterhouse. They are basically pointing here with a knife to the adult forms of the fluke that are being expelled from the bile ducts as the liver is being sliced and compressed. Notice the thickness of the walls of those bile ducts. There is even a local lymph node which should barely be noticeable and is quite enlarged from the inflammation the parasites are creating. And there are really numerous reports in other countries of resistance to tricobendazole, which has been traditionally used to treat liver fluke, and is really the only drug that we have available in Colombia, at least for this parasite. So we need urgently to find out if this drug may no longer be effective in this part of the world also. It's not shown in this table, but it's worth noting that the infected animals were mostly adults that were considered more than 1 year old. And there were very few young animals that were shedding eggs of Fasciole. With this parasite, unlike the roundworms, the adults don't really mount an immune protective response as you would expect for most other parasites. So we cannot really count on acquired immunity to help us fight the parasite, and we really need to implement some strategies to prevent exposure in order to protect our livestock. Having said this, I wanted to thank you again for watching this presentation, and I welcome you to watch the final one on integrated management practice. So be well and goodbye.